Hi, and welcome to our presentation on navigating social media for healthcare students.
As students on a HCPC regulated course, it's crucial to ensure that our online activities align with the professional expectations, allowing us to benefit from social media whilst also avoiding any breaches of standards.
The HCPC sets codes of practice for us to follow, protecting both ourselves and the public.
The learning outcomes of this session are to identify the benefits and risks of social media for healthcare professionals, to develop the knowledge of HCPC social media guidelines, and hopefully gain some actionable tips for managing your online presence. The HCPC standards are ethical compass. The HCPC's standards of conduct, performance, and ethics form the foundation of our professional practice. These guidelines dictate how we interact with service users, colleagues, and the community, ensuring we operate ethically. Regularly reviewing these standards on the HCPC's website keeps us aligned with the ever-evolving landscape of healthcare ethics and regulations. Have a quick think. What do you feel the benefits of social media are as a healthcare professional? Social media is a powerful tool that has transformed communication within healthcare. Platforms like LinkedIn and X, which is formerly Twitter, facilitate education, collaboration, and professional visibility. You'll find you're just one click away from engaging with senior healthcare professionals and observing their activities. A study even suggests 64% of clinicians use social media for professional purposes. Social media's role extends beyond personal use to professional development and services use and engagement. It offers continuous learning opportunities, public health advocacy, and professional networking. However, using social media effectively requires balancing it with the standards and preserving professional integrity and trust.
While social media offers many benefits, it can also pose challenges, such as maintaining confidentiality, managing professional boundaries, and also balancing personal beliefs. A single misstep can damage service users' trust and professional credibility, highlighting the need for careful use of social media. So let's talk about standards in social media. Our online presence reflects our professional identity and must adhere to the same HCPC standards that guide our offline behaviour. So whilst posting online, we must still have the same integrity as we would in person. This continuity emphasises the importance of integrity and professionalism in all mediums. Our digital footprint is permanent, making foresight and discretion essential in online activities. So be mindful when you're posting and maybe have a look back at what you've already posted.
Championing equality and inclusivity. We must actively challenge discrimination and bias. We must ensure equitable treatment. This is as much as online as it is when you're working in person. We must make sure there's access across our digital interactions and uphold those values of respect, inclusivity, and non-discrimination. This is the core. This goes right back to the ethical compass we were talking about at the start. We must make sure we're not using our own personal biases on professional social media accounts. And we also must make sure that we're fostering an inclusive healthcare environment within our digital engagements. Okay, so professional boundaries. What would you do if a service user actually contacted you on social media or sent you a friend request? Some things you could do is update that account's privacy settings. But would you reply to that message? What if it was important? Let's just have a quick think about that. Maintaining clear professional boundaries online is also crucial. Strategies like separating a professional and a personal account can help make sure that your online conduct remains appropriate and respectful. Always communicate with service users professionally. You should always discuss this with your employer as they will have guidance on this. But be cautious if a service user contacts you through social media. It's recommended that you do refuse friend requests and clarify that mixing social and professional relationships is inappropriate. If a follow-up is needed, use a more secure channel, such as your professional email.
Effective communication. Effective communication is a cornerstone of healthcare, requiring the same professionalism online as it would in person. Our commitment to accuracy, evidence-based information, and confidentiality must remain strong when engaging on social media. These principles guide our interactions, reinforcing the trust and confidence that service users and the public have within us.
Respecting confidentiality. It's essential to maintain service users' confidentiality to build trust. When interacting digitally, we handle service user information carefully and always obtain consent before sharing any identifiable data. It is always best to never share information that can identify a service user or a carer. Violating this trust can result in legal consequences and damage the relationship between the healthcare provider and the service user. This highlights the importance of being cautious when online.
Let's talk about professional integrity. As healthcare professionals, it is crucial to display honesty and integrity in our online activities as we would our everyday lives, ensuring our communications are accurate and absent from any misleading information. Adhering to this ethical behaviour is vital for upholding public trust and bolstering the credibility of the healthcare professions. It also means that you are providing disclaimers if you are working on any paid promotion, and you should be considering whether the paid promotion or advertising is appropriate, so do your research. Remember, the Data Protection Act also applies with implemented GDPR to ensure posts do not breach any legislations. It is also essential to gain permission before sharing work with intellectual property, such as copyright, and providing proper references to your sources.
Here are some of the HCPC's top tips. This slide is well worth a read. Understand who can see your posts and know that each social media channel has its own privacy settings. Assume that anything you post online is visible to everyone. If you're using social media for professional purposes, ensure that information is fair and accurate, including a disclaimer that the views are your own and not your employer's. Consider maintaining separate private and professional profiles. Keep posts confidential. Information shared online can be quickly copied and redistributed. Avoid using language that could be considered inappropriate or offensive. And remember, the new 2024 guidance suggests to challenge discrimination. Follow your social media policy of your employers, and if you have any doubts, seek advice. Here, I will quickly discuss the key changes in the 2024 HCPC guidance on social media compared to the 2017 guidance. The 2024 guidance explicitly acknowledges registrants' right to freedom of expression, as in Article 10 of the European Convention on Human Rights. This right is to be respected and upheld, but it's important to note it's not an absolute right. Registrants must ensure their posts do not violate other standards or laws. This inclusion underscores the balance between free speech and professional responsibility. The new guidance also suggests maintaining separate personal and professional social media accounts. This helps registrants manage the boundaries more effectively and ensure professional conduct is maintained. It also makes it much easier to handle interactions with service users professionally and minimise the risks of boundary violations. A significant update in the 2024 guidance is the requirement for registrants to review historical social media posts. Even if posts are made before becoming a registered professional, these can be scrutinised against current standards. Registrants should delete or modify past content that might conflict with professional expectations and ensure they remain compliant. The guidance also now calls on registrants to actively challenge discrimination. This means ensuring that their personal values and biases do not lead to discriminatory behaviour or impact service delivery. Social media posts should reflect this commitment. Avoid using any content that could hinder access to services or perceived as discriminatory. The 2024 guidance also includes a clear definition of misinformation and emphasises the importance of accuracy in social media posts. Misinformation refers to inaccurate or false information shared online without intention to cause harm. For example, inaccurate photos, dates, or news reports. Registrants must ensure that information they share is truthful and reliable. That involves verifying sources, correcting false information, and ensuring that posts contribute to public health and professional standards. Finally, the guidance also provides additional instructions on advertising. Registrants must ensure that any promotional activities on social media are accurate and not misleading. This includes making reasonable checks on information shared and possibly using disclaimers to clarify that personal views do not represent their employer or professional body. Right, here we go. We've got a QR code for a quiz. You can get your phone out and give it a quick scan. Just remember, by adhering to these guidelines and best practices, healthcare professionals can navigate social media effectively, and we can all benefit from this. There's advantages to social media, but just remember you're maintaining professional standards and including public trust. So have a quick look at this quiz, and you can scan the QR code and test your knowledge on today's session. So, I hope you found that quiz useful. You can access all the social media advice on the HCPC website, and we also recommend refamiliarising yourself with the HCPC Student Codes of Practice.
We have left all legislation sources and a disclaimer on this slide for your use. Thank you very much for listening and attending this presentation.